Welcome to Wednesday Wellness Debrief, your journey to wellness and maternal health. I'm your host, Brittany, and today we're diving into today's important topics, strength training and pregnancy, and a new segment with a focus on maternal health in the news. If you're finding our content helpful, please take a moment to follow us on your favorite podcast platforms, like this episode, and subscribe so you don't miss on any future discussions. Disclaimer, our aim with this episode is to offer a supportive space for learning and discussions about wellness. However, it's vital to understand that the information shared is not a substitute for professional medical consultation. We encourage you to use what you learn here as a starting point for conversations with your own medical provider, who can officially diagnose and develop a treatment plan tailored specifically for you. But first, we're introducing our new segment to keep you informed and in the know. We're calling it Maternal Health in the News. I'll be bringing this segment up whenever something in the news or social media truly tickles my maternal health senses. And when I saw this headline this week, I knew we had to talk about it on the podcast. This is a local story that popped up on my Facebook feed from the newspaper Leesburg Daily Commercial by Julie Garcido. And sorry, Julie, if I messed up your last name. Quote, shifting priorities, hospital to close Leesburg OBGYN ward to accommodate older patient care, end quote. This hospital is closing its labor and delivery ward due to a significant decrease in births and changing community demographics to a more elder population. I read the article, and the vice president of the hospital that is shutting down the labor and delivery ward is working with another local hospital to assist with the transition of the patients and everything in between. However, I will say I did a little research, and the hospital that is taking on the OB patients and everything, they're 17 minutes away by car. I want you to keep that in mind as we go through this segment. In the article, some local mothers and even some local gynecologists have expressed concern that the closure will be dangerous and harmful to the community. I will state that shutting down this facility's OB ward does impact geographic proximity and the provider availability, which does fall under social determinants of health for access and quality of care. Shameless plug, I do have an episode that breaks down all of the pillars of social determinants of health. I'll put that in the description if you want to understand why this is so vital. I found this amazing article, quote, maternity ward closures exacerbating health disparities, end quote. This is from Assistant Professor of Health Policy and Politics at Harvard School of Public Health, Alicia McGregor. In the article, it states nationwide, 217 OB units have closed between 2011 and 2023. And they created these so-called maternity care deserts. They are defined as counties lacking OB care. The reasons cited for closures include declining birth rates, staffing shortages, increased costs, and the chilling effects of new anti-abortion laws. I will state in the article, a lot of the local mothers have their own opinions on why they're closing the OB ward, and I would encourage you to read their thoughts and opinions in that article. I do also want to state, I did have this discussion of perinatal healthcare deserts with birth advocate Portia Holland Atumbe in a recent interview.
We're oversaturated, and our more rural, smaller towns, their hospitals are closing like 90. You might have one midwife. You might have two people that can teach you anything about breastfeeding or feeding your baby. It's actually really desert-like for the whole perinatal journey in many parts of the country.
I do want to add, Leesburg, Florida was ranked the third fastest growing city in Lake County. And a lot of focus of maternal health deserts are rightfully on rural communities. But I do want to point our eyes at growing urban communities are losing OB wards. I want to go back to Professor McGregor's Harvard article, where it states that county level analysis misses the more granular disparities that exist in urban settings. While people are living in Southwest DC still have OB care available within their census defined, remember I said the hospital is 17 minutes away, the time and effort it takes to get to these facilities, particularly for those lacking a car or for whom are paying for parking, is cost prohibitive and presents a considerable burden. Think of it. If the hospital is down the street from your house and you don't have a car and the new hospital is 17 minutes away, that causes a lot of stress on that person and their family. So, to the listeners for this segment, on a personal level, this is a call to be your own advocate. Please do not be afraid to ask your provider about your hospital plans, your birthing options, and resources in your area. On a community level, we can advocate for policies that support hospitals and expand access to midwifery care, doula services, and just more access to telehealth. I do have an episode coming up on telehealth, so stay tuned for that. The health of our community starts with the health of our mothers and babies. I'm going to close off our first ever maternal health in the news segment with an important statement from my interview with Portia. Thank you for listening, and I'm excited to get into strength training with pregnancy after this. Really scary, especially as a Black woman and with all the changes happening. It makes it even more of a nerve-wracking situation, kind of bare knuckling it through the situation.
Absolutely, it can be. So I feel like it puts a different spin on family planning. Like, some people may organically just want to pop up, but I feel like if you want to live in the US, gone are the days of organic. You need to know what in the world is going on, where you're living, who to call on, what insurance you have or don't have. This is not the time to play. So at least have an idea of what's available to you as you get ready for this journey so that you're not shocked dealing with the stress factor plus all the symptoms that come with regular pregnancy.
For many years, there has been a common misconception that pregnancy is a time to slow down significantly, especially when it came to exercise. While rest is undeniably important, we now have a wealth of research demonstrating that strength training can be incredibly beneficial to both the birthing parent and the baby. First and foremost, strength training helps manage pregnancy discomforts. As your body changes, you'll likely experience alignment shifts in your posture, new aches and pains thanks to hormones like relaxin that relaxes, see what I did there? The joints, ligaments, and other connective tissues that makes it easier for the baby to grow in your body. So, focusing on strengthening your core, your back, and your glutes can provide vital support for your growing belly, alleviating common issues like lower back pain and sciatica. And I do want to emphasize your muscles need to be stressed to adapt and tolerate the additional weight and shift in alignment. And I tell my participants in my strength training class, if you feel good with your form and alignment, add on that additional weight to your bar so your body builds your muscles during the tension of the workout. Secondly, it prepares your body for labor and delivery. We've talked about on the podcast, childbirth, in a sense, is an Olympic event. So having strong muscles, particularly in your legs, core, and glutes, improve your stamina and endurance during labor. It can also help you maintain various birthing positions like squatting, standing, hands on your knees, shout out Sexy Red, more effectively, potentially leading to a more comfortable and effective delivery. I actually may do an episode on how King Louis of France impacted how we give birth today. That's been in my drafts for a little bit, and I may bring it out just for a special episode, especially after my trip from France. Thirdly, strength training can improve your energy levels and mood. Pregnancy can be exhausting, but believe it or not, regular exercise, including strength training, can actually boost your energy. It improves circulation, enhances sleep quality, releases those wonderful endorphins that act as a natural mood elevator. It actually makes me think of the quote from Legally Blonde: exercise gives you endorphins. Endorphins make you happy. Happy people just don't shoot their husbands, they just don't. And let's not forget about postpartum recovery. Building and maintaining muscle mass during pregnancy can significantly aid in your recovery after birth. Strong muscles can help you have a good baseline of strength and will make it easier to handle the physical demands of ADLs, aka activities of daily living, like caring for a newborn. Think of it. You're lifting your baby from the bathtub or the floor, you're carrying a car seat, you're navigating sleepless nights. Having that solid foundation really helps. Now, I know some of you on the other side are thinking, but is it safe? And that is a very valid question. The answer is a resounding yes for most healthy pregnancies with the proper modifications and guidance. It is critical to listen to your body, avoid exercises that put undue strain on your abdomen, and prioritize proper form. This is actually, like I stated before, something I get to witness firsthand as I'm teaching a strength training group fitness class. And it is truly inspiring to see people of all fitness levels, including those who are pregnant, embracing the power of strength. Now, remember, before embarking on any new exercises during pregnancy, it is absolutely essential you consult your healthcare provider. They know your individual health history and can provide a personalized recommendation. Once you officially get the green light, consider working with a qualified pre and postnatal fitness professional who can guide you on safe and effective exercises, proper progressions, and necessary modifications as your pregnancy progresses. This week, I want to talk about something personal. We've talked on the show about the challenges families face and the need for better resources and training for those who support them. That's why I'm asking you to help us for an event called The Climb, a program of Postpartum Support International. The Climb is the world's largest event dedicated to raising awareness and understanding perinatal mental health disorders. The Climb is more than just a name. It represents an uphill battle many families and professionals face every day. Our team is climbing to raise money to help make the journey a little easier. When you donate to our team, you're not just giving money, you're directly contributing to free resources for families, providing critical training for both clinical and non-clinical providers. Every dollar helps give families the support they need and ensures all those who work with them have the best possible training. And because PSI is a registered non-for-profit, your donation is tax deductible. I left the link in the show notes below if you choose to donate. And if you do decide to donate, I do want to thank you for helping make the climb happen in my backyard. Thank you. And that's our show for today. Thank you so much for joining me and for trusting me to be a part of your wellness journey. I hope this episode has shifted your perspective a little bit, reminding you that your body is a masterpiece of strength and that moving it with intention is one of the most powerful things you can do for yourself and your baby. All articles and links mentioned in the episode will be in the description below. If you're enjoying this episode, please tap the subscribe button wherever you listen to podcasts. Subscribing is completely free and it's the easiest way to make sure our empowering conversations on maternal health show up in your feed every week. I want to hear from you. What is your biggest takeaways from today? Join our community on Facebook, Instagram, or TikTok at PVF_tribe, and let's continue the conversation. Until next time, stay strong, stay nourished, and stay well. Bye, everybody.